All right, good afternoon, everyone. I am Marcel Rodardi, Executive Director, coming at you live from the Contract Cities COVID-19 Headquarters and Research Center, located in a secret underground bunker. Today, we're going to be talking about the risk management with COVID-19 and some potential legal exposures your cities might have as we start to reopen, as we start to find a path forward into what our new normal after COVID-19 will look like. But first, as I mentioned last night, for those of you who attended our board meeting, first thanks. I want to show another video. This one is for the JPIA that Pepe Smith produced. It's a really, really solid video. So I'm going to share that with you right now because we want to make sure that our folks are getting the proper exposure and that their membership and their benefits are very valuable to them. So please watch this.
In the mid-70s, there was an insurance crisis. Case law was finding that there were liabilities associated with cities that some insurers hadn't really perceived before. The Contract Cities Association had an infrastructure in place to address a variety of issues, and so they put their city managers committee on the task of trying to come up with a solution for this insurance crisis. When the cities formed the California JPIA, as we call it today, it was really about ensuring that there was reliable coverage available. We work with the members, finding out what's going on in their organization to try to help them manage risk better.
All right, so that was the JPIA video. That was produced by Pepe Smith and Associates. JPIA has been a great partner with us for a very long time, and today we're fortunate enough to have two folks from the JPIA. First, we have Jeff Rush. He's worked in the insurance industry for over 27 years with a focus on workers' comp. He began working on behalf of public entities in 1995 and has worked for, wait a minute, I'm gonna back up a little bit because I see in my screen here, I forgot to introduce our president. She wants to give you all a quick welcome, then we'll go into the introduction. So my apologies to our president, Lindsay Horvath. Please take it away.
Thanks, Marcel. I spend every Thursday morning volunteering for Project Angel Food, so I didn't have the time to make the quick change before this meeting, so pardon my casual appearance, but thank you very much for putting this event together, to our staff at California Contract Cities Association for making this very valuable content available, not only live today, but on an ongoing basis online after this meeting is over. And I want to thank all of our panelists and partners who are participating in this conversation. Obviously, the issue of risk during a global health pandemic, shutting down and reopening, and what does that all mean for our cities, couldn't be a more important conversation for us to be having right now. And so I just want to thank you all for the conversation that we'll share today, for the work that we'll continue to do after today's conversation, how we take it back into our communities, and for your active participation. Use this opportunity to ask questions, to build relationships, and to get the answers and resources and support that you need for those gaps in services that you're experiencing that, quite frankly, nobody ever really anticipated was going to be our reality this year, but here we are. And thank you to everyone who's helping us to get through this very difficult time. Marcel, I'll turn it back to you.
Thank you, Lindsay. Always finding a way to say the exact right thing at the exact right time. So thanks, Lindsay. We appreciate your leadership. And so back to where we were. So as you heard earlier, Jeff has been in the insurance industry for a long time, before I was born, 27 years ago. Let's see, his prior experience includes tenure as workers' comp claims examiner, claims supervisor, claims manager, excess specialist, and independent auditor. He served for nearly 8 years as the workers' comp program manager for the California JPIA, a risk management pool with over 100 members statewide. Jeff graduated from Cal State Sacramento with a bachelor's degree in criminal justice. He also holds multiple professional certifications, including Chartered Property Casualty Underwriter, Associate in Claims, Associate in Risk Management for Public Entities, and a Certified Professional Disability Manager and Workers' Comp Claims Professional. He serves on the board of directors for the Public Agency Risk Management Association and the Legislative Committee for the California Association of Joint Powers Authorities. Next, we have Maria Galvan. She's a Senior Risk Manager with the California JPIA. It's a municipal self-insurance pool with over 100 members statewide, as I just stated. She consults with members on safety, contractual risk transfer, and other risk management matters. In addition, she helps resources to assist member agencies. She develops resources to assist member agencies with the risk management programs. Prior to joining the California JPIA, Maria worked for a contract city where she maintained responsibility for risk management, administration, and housing rehabilitation. Maria's experience also includes working in the private sector, overseeing business development and guest relations. Maria holds a Bachelor of Arts degree in Political Science from Cal State Fullerton. She also holds an Associate in Risk Management for Public Entities and Designation. Maria serves on the Litigation, Insurance, and Tort Liability Committee for the California Association of Joint Power Authorities. Finally, our third speaker today is a past mayor and council member from the city of Montebello. He is now a city attorney that represents 5 cities on his own, and his firm represents 8 total, Arnold Glassman Alvarez. So with no further ado, I'll turn it over to Jeff and Maria, and then Arnold will follow on with some more. He may chime in some different areas when it comes to the legal expertise, but I will hand it over to Jeff and Maria.
Thank you, Marcel. Appreciate the invite and appreciate everyone taking time out of your day today to talk about risk management, particularly relative to COVID. And obviously, this is not a new topic. It's something we've been dealing with for quite some time. And my focus today will be on the workers' compensation space. And in doing so, I'd like to talk initially with regard to the governor's executive order, which was issued quite some time ago, back on May 6th. And I know a number of you have dealt with that issue at your agencies, whether directly with your employees or those that are providing services for your employees. This was an unprecedented action by the governor because we haven't had an executive action taken like this in the workers' comp space, but we're also living in an unprecedented time where we are dealing with a global pandemic. So the governor saw fit to take action. There were some questions regarding the constitutionality of that, but really it's a moot point because that executive order has since expired. But to do a quick overview relative to what that executive order did, it created a presumption relative to COVID-19 for all employees throughout the state of California. And what it indicated was there is going to be a presumption in workers' compensation for an employee who has exposure to COVID-19. And before getting into the details, just a quick primer on presumptions. A presumption states that the condition at hand is going to be considered work-related for that employee, and the employer has to come up with evidence to rebut that. So it really puts the burden on the employer, whereas in most workers' comp matters, the burden starts with the employee. So some of the main tenets of the presumption were if an employee was showing up at the work site anywhere in a 14-day period before they were diagnosed with COVID, and that condition was appropriately diagnosed by a doctor and verified with testing, and the employee presented a claim of COVID, then that claim would be considered presumed industrial. Just to give you a little bit insight into the JPIA's experience to date, we've had over 350 claims filed by our members for COVID claims. A good portion of those have been denied, and the denial is simply because the employee did not test positive for COVID. They did not meet that bar with regard to testing. Now, digging in just a little bit with regard to the presumption, we did have one case during the presumption period, during the window covered by the executive order, where an employee had a claim and a positive diagnosis, but the claim was denied. And again, it's not easy to deny presumption. The facts in this case were simply that the employee was a police officer. They were not able to cite any exposure to COVID among their coworkers or among any member of the public they had contact with in the preceding 14 days. But what they did have was a living girlfriend who had COVID symptoms prior to this officer developing it. So when the officer presented that, the only source that we could identify potentially bringing them the COVID infection was that girlfriend. So that is the only case that we have where a denial was issued for an employee that developed a positive diagnosis. So again, the vast majority of the claims that we've had have been accepted. And I'm also happy to report the vast majority of the claims we've dealt with where the employee did have COVID have recovered without substantial lingering effects. We have had a couple of a more serious nature, but most of the claims are kind of in the system and out of the system. And that gets us to the point where we are now. Marcel, could we jump ahead a couple of slides to the first slide relative to SB 1159? Thank you. So I was all ready to talk about SB 1159 as a bill awaiting the governor's signature, but within the last hour, the governor put pen to paper and SB 1159 is now law. And here you see a picture of Senator Jerry Hill from Northern California. He was the author of this bill. There was extensive input into this bill from both employers and employee groups. There were also a couple of competing bills. It was a very active end to the legislative session. This was ultimately the one bill that made it to the governor's desk. And you see a large group of employees covered by this presumption. It does not cover all employees, as the governor's original executive order did. So the main focus for our members is going to be firefighters, peace officers, potentially EMTs, and fire and rescue service coordinators. You see here some other employees listed as well, and these are folks that might be employed by counties or even in the private sector, those that are providing healthcare, registered nurses, other employees with direct patient care, and even some of your IHSS employees. So we've got a long list of employees who are going to be covered by this presumption. Marcel, can we jump ahead one more slide? We're going to get into a little bit more detail about the presumption. So we have all those employee groups covered by the presumption, but we have another exposure that's created by this presumption, and that is the term known as an outbreak. And there was a lot of wrangling back and forth as to this term and who would be covered. When this term originally came out, the hope on employers' part was, we want to set this bar at 5 and 5%, 5 coworkers. Labor wanted it 3 and 3, which would have been very challenging. We ended up with what we see as 4 and 4. So to get into a little bit of detail about these outbreaks, if you have an agency with more than 100 employees and 4% of your workforce tests positive in the preceding 14-day period, you are deemed to have an outbreak. If you have less than 100 employees, between 5 and 100, and 4 employees test positive in that preceding 14 days, you have an outbreak. Additionally, any workplace closed by local or state health departments, Cal OSHA, or a school superintendent is deemed to have an outbreak. If that outbreak is in place by these criteria, all employees are eligible for that presumptive coverage at that point. So that casts a really wide net among your workforce, if indeed you've got this situation. Now, some of you still have employees working at home. Those employees not physically coming to work are not eligible for the presumption. So this pertains to your employees who are showing up at the work site. So those at your city hall, those that are at remote sites, those that are in the field. So the employee has to be physically out of their home doing work in the community, at the city hall, places of that location. Marcel, why don't we jump ahead one more slide if we could. One of the other responsibilities that this bill creates is a requirement that you as an employer notify your claims administrator within 3 days of a number of requirements. Now, some entities may self-administer claims. We at the JPIA work with a third-party administrator. That's an entity that actually handles the claims. That's probably what many of your agencies are doing. But you need to know who that claims administrator is. You need to notify them when these 4 things have taken place. If an employee has tested positive, and also the date that that employee's specimen was collected for testing, the address or the addresses where the employee was working during the preceding 14 days. So really we're looking at a contact tracing element that's being embedded in this bill. And also the highest number of employees who reported to work at that place or places of employment during the preceding 45 days. This particular component is one that creates a lot of heartburn for employers because this requires a lot of tracking on your part. And this bill, again, is active right now. This was implemented as an urgency measure. This bill is law as of this minute. And not only is it active now, but it has a retroactive component specific to the presumption. So your employees who were no longer eligible for that presumption as of July 6th, the date the governor's executive order expired, they are eligible to have this reach back over 2 months to that July 6th date. That claim may have been denied, but now it needs to be looked at again by your claims administrator for potential coverage on the part of the employee. So returning to these tenets of SB 1159, if an employer does not do these things and does not provide their claims administrator within 3 days of this information, the labor commissioner can issue a fine of up to $10,000. So there's obviously some high stakes associated with the compliance on these different categories. One thing that I think is real interesting to note is a lot of times when we're working on a bill on the employer side, the other side is represented oftentimes by the California Applicant Attorneys Association. These are attorneys representing injured employees. They were actually not in favor of these components of the bill. They felt that this would be too cumbersome. And so they realized we've created a great burden on the employers in California, but nonetheless, labor was supportive, and this is what we have in place as law right now in California. Marcel, why don't we jump ahead one more if we could, please? So as I mentioned earlier, the bill takes effect immediately. This is current law, retroactive to July 6, 2020. And the law is valid all the way through January 1st, 2023. So there's a lot of time on the books, over 2 years that we're going to be dealing with this. Hopefully we'll be through the throes of COVID long before then, but the legislature wasn't sure when that would happen. So we're going to have this law on the books for quite a long time. One of the other things to know about this law is a normal workers' compensation claim, when there's a need to investigate it, the employer has a 90-day window. That might seem like a long period of time, but there's a lot of information to be gathered. We might need to talk to the employee, get a statement from them, potentially speak to coworkers, and then trying to get their past medical history when there's a pertinence there to a current injury can take a long period of time. Well, for those covered classes of employees listed on the earlier slide, your safety officers, your fire personnel, your health workers, we cut that 90-day window by 2/3, so we only have 30 days to investigate those claims. When an outbreak has been deemed, the law gives us 45 days. Either way, the period has been shortened, so a lot of work needs to take place to identify, is there a potential exposure outside of work that that employee may have had that led to their COVID exposure? And so a couple of the things I want you to keep in mind relative to COVID, and these are separate from SB 1159 and things that you may be aware of, but you may not have experienced. When COVID hit, it started to cause a lot of delays in terms of medical care for employees with an existing workers' compensation injury, because obviously there's a high impact on the medical system. We have employees who are seeking care for an urgent issue, a global pandemic. So employees that had routine appointments, employees that maybe were awaiting an MRI or a CT scan, or in many cases a surgery, experienced delays in care. One of the vendor partners I deal with was actually awaiting a surgery for cancer, and her surgery was delayed for a number of weeks because COVID started to take over, and additionally, medical providers were trying to set in place their own risk management best practices so they could avoid the exposure to people coming in with cancer, with orthopedic injuries. So COVID is causing delays for people that don't even have COVID. It's also caused a lot of delays in the legal system. We have a lot of cases administered through the workers' comp system at the court locations, known as the workers' comp appeals boards. And we have not had live hearings taking place. Many hearings have been delayed. Earlier this month, the WCAB, the Workers' Comp Appeals Board, implemented their own system similar to Zoom, where they can do hearings over video. But there are a lot of concerns about that as far as whether or not we're getting testimony that's as accurate, if the employee is potentially being coached by somebody off screen, things of that nature. So it really impacted the legal system a lot. It did so as well in the deposition arena. Depositions happen regularly, even when a case doesn't actually ever require a court hearing. Depositions were delayed, and all of a sudden there was a desire to have those take place remotely. So the legal system has had a lot of cases that have been slowed down because of COVID. One of the other things that's taken place is employers are finding alternative ways to provide care to their employees. At the JPIA, we've worked for nearly 7 years with a service known as Company Nurse that provides employees telephonic triage at the outset of an injury. So the employee doesn't have to step foot in a doctor's office, and they're getting access to a medical professional. And so that's something that we've been utilizing. And also we've moved on to telehealth, where we have a provider that lets an employee actually meet with a doctor for an appropriate condition and do a medical examination over Zoom. Conditions that we previously thought maybe wouldn't be best suited for Zoom, all of a sudden we're doing more of that because employees don't want to step foot in a clinic. They don't want to be exposed to people that might have COVID themselves. So we're doing everything we can to provide care in a way that's safe, that's appropriate, but also mitigates that employee's exposure to COVID. One of the other things to keep in mind, we're dealing with a brand new condition here. We don't know the long-term effects of COVID. I mentioned earlier, a lot of the claims we've dealt with are in and out of the system. That's the end of story. But we don't know at what point some of these claims may come back where an employee has a recurrence of symptoms, and we need to reopen that claim because they have a subsequent condition that's been linked by a doctor to COVID. We're just getting started here. We're going to see, I'm sure, a litany of studies conducted by experts in the field with regard to the different effects of COVID. Some of the things we know are people with pre-existing conditions are more likely to have problems. Those with obesity, those with diabetes, that leaves people more likely to experience some complications from COVID. But those are just what we've learned here in the first 6 months or so. There's a lot of research to be done and a lot of long-term impact that we have yet to fully realize.
Thank you, Jeff. Now I'm going to talk about reducing the risk of COVID-19 at your workplaces. As an employer, you are required to have an injury and illness prevention program. You have to maintain a safe a healthy work environment free of serious hazards. What your IIPP includes is policies and procedures for addressing those hazards. Your IIPP is a more broad safety program, and following that broad safety program, you should have specific safety procedures and programs in place. For example, heat illness prevention program or a hearing conservation program. And now, because of this new exposure, a COVID-19 exposure control plan. The IIPP regulation was recently revised, and employers are now required to provide the employee with access to the IIPP program, the written program, within 5 days. You may ask yourself, well, we've already provided the employee with access to the IIPP document. Why is this a new requirement? That requirement is extended, so the employee can actually designate a representative to get access to your agency or city's IIPP. And that representative could be an attorney or a union representative, as an example. Next slide, please. So earlier I mentioned that now, because of COVID-19, you should have an exposure control plan to address this new hazard in the workplace. Many of you are members of the California JPIA and may have received or reviewed a copy of our COVID-19 exposure control plan, which again is a supplement to your IIPP program. There are various factors or elements that should be included in this exposure control plan. It should include information on what COVID-19 is and its transmission and how you can prevent getting COVID-19. You should also include specific department guidance. For example, you may have recreation departments or employees working out on the field. The CDC and the state do have specific guidance for these different areas. You should also identify what your cleaning procedures and your disinfecting procedures are, and how often you're disinfecting those high touch or high contact surfaces. You should also outline your social distancing protocol and any workplace reorganization that has taken place. For example, if you're limiting the number of employees that can enter an elevator at the same time, or if you're installing plexiglass to protect those employees that are working in an area with other employees nearby, or if you're limiting the number of members of the public that are entering your facility at any one time. If you're removing pens from your common areas or magazines, as most cities do have materials for the public out in common spaces. The COVID-19 exposure control plan should also address face coverings. I know that's a state requirement right now to wear a face covering when you're out in public and social distancing is not possible. You should also outline when your employees are required to wear personal protective equipment, for example, for employees that might require respirators, or employees that should wear gloves for certain tasks, or any other PPE that you may provide to protect them. If you are testing employees before they return to the workplace or periodically, make sure your exposure control plan addresses this, as well as if you're requiring employee health certifications and any temperature checks. Next slide, please. The exposure control plan should also address employee travel if you are allowing employee travel. I know most cities and agencies have put a stop to travel in the interim, but if you are having travel take place, make sure you outline what procedures your employees should follow. Your exposure control plan should also identify what to do if an employee is exposed to COVID-19. And then the last three items here that we included in our exposure control plan template is mental health resources. This is a very challenging time for all of us, and it's recommended that your exposure control plan address any mental health services that you have available for your employees. For example, your employee assistance program. I also recommend that you look at your county for resources. I know some counties offer virtual support groups, as well as other resources for members of the public. Lastly, the two items, workers' compensation procedures. Your exposure control plan should identify what steps an employee should take if they are exposed to COVID-19 in the workplace. And then lastly, you might ask yourself, why is a reference to our discrimination and harassment policy mentioned in a safety exposure control plan? And the reason why I had suggested including this is there are individuals out there that are being stigmatized due to either their race. Another example could be they were previously exposed to COVID-19 or had COVID-19, or they might have a lingering cough for a different condition that they have, a pre-existing condition. And this just serves as a reminder in your exposure control plan that that your agency prohibits discrimination and harassment. Next slide, please. So recently, Cal OSHA issued an alert indicating that they've cited many employers for COVID-19 violations. The industries that were highlighted in this alert were food processing, healthcare, and other agencies that might not be public sector employers. I haven't seen or read of any specific public sector citations, but I know that Cal OSHA has received thousands of workplace complaints related to COVID-19, and we don't know if we'll see any specific to the public sector. And the penalties when an agency is cited could be a couple $1,000s to hundreds of thousands of dollars. So it's really important that you do implement your COVID-19 exposure control plan at your city. Next slide, please. The reasons why these organizations or employers were cited is because they didn't, in fact, update their safety plans to address the exposure of COVID-19. And oftentimes, inspections by Cal OSHA are opened with complaints. If they do receive complaints from employees, they'll go out and inspect and evaluate whether there's an exposure or if they're notified of a serious illness related to COVID-19. Next slide, please. So now I'm going to talk about a couple of areas that my risk manager colleagues and I have received questions on. We kind of skipped over the legal disclaimer at the beginning of the PowerPoint, but I do want to start by saying I'm not an attorney, so we do recommend that you reach out to your own city's legal counsel on these various matters if you have specific questions. So the first topic that I'd like to discuss is reasonable accommodations. We've seen an increase in requests for reasonable accommodations, which are modifications to an individual's job or duties because of COVID-19. And it's recommended that if your HR team isn't comfortable or doesn't have the experience with conducting the interactive process meetings in order to determine whether you can accommodate the employee's request, we highly recommend that you work with your employment practices legal counsel or with a consultant that specializes in reasonable accommodations. The next area we've received a lot of questions on is telecommuting. It's really important that you have a policy in place addressing telecommuting, that you make sure that you have performance standards and performance management in place, because working from home is not for everyone, and also that you're reimbursing your employees for business-related expenses, and that may include internet usage. The next area that we've received a lot of questions, well, before I go to this area of travel, one thing that is really important to remember is to work with your IT department or your IT consultant to make sure you have the proper security in place to ensure cybersecurity. Next is personal travel. Can you dictate where your employee travels on their personal time? If you are considering this, we recommend you consult with your legal counsel, because this can enter an area where you're invading into your employee's privacy. do we contact trace? We received a lot of calls from our member agencies that they received emails and phone calls advertising contact tracing apps. Again, with contact tracing, there could be an invasion of privacy allegation, and we do recommend that you consult with your legal counsel before purchasing these services. And then a question that's coming up now that we're getting closer to having a COVID-19 vaccine is, can we require mandatory vaccines? And this is not something that I would recommend, and many attorneys probably would agree, because there is going to be pushback and questions from employees for requiring vaccinations. There might be legal issues if an employee, in fact, cannot get a vaccine due to religious, personal, or other reasons. Next slide, please. So now I'm just going to go over a couple of questions that we've also received from our member agencies before I turn it over to Arnold. Again, I'm not an attorney, but we did consult with legal counsel on these questions, but we do encourage you to consult with your attorneys as well. The first question is, can we take the temperature of employees who return to work after being ill, or take temperatures of members of the public entering our facilities or public meetings? For employees, the Equal Employment Opportunity Commission, or EEOC, has issued guidance in this area, and they have indicated that it is acceptable because of the spread of COVID-19 for you to take employees' temperatures. With members of the public, we did obtain a legal opinion on this, and it's not suggested that an agency or city take temperatures of members of the public, because it is considered a medical exam, and it could be a violation of the Americans with Disabilities Act. Again, there might be some agencies out there that are currently taking temperatures when members of the public are entering your facilities, but we do advise that you consult with your legal counsel on this. The next question is related to closures of businesses, and then what's going to happen when we open our facilities and resume operations to what's the new normal. So what liability do we have if a member of the public alleges that they contracted COVID-19 at our facility? Liability is limited because it might be difficult, it is very difficult to prove that they in fact contracted COVID-19 at your agency. Where there could be some possible liability is if you as a city know that an individual has COVID-19 and you allow them to enter despite them being having COVID-19. So what do we do to address this heightened concern of potential liability of receiving a claim or perhaps a lawsuit related to this? You might see signs warning on COVID-19 at doctor's offices or places such as downtown Disney, Universal City Walk, that warn the public of COVID-19. We did talk to legal counsel, and they suggested, while not required, you can post similar signs at the entry points of your facilities, warning the public of COVID-19 and that they're entering the facility at their own risk. It could help in the event a claim or lawsuit is filed. And then the next question is, we're resuming operations and we're concerned about potential liability with having vendors and contractors work on site. Should we revise or update the indemnity provisions in our agreements to specifically reference COVID-19? The indemnity provisions in your contracts is the provision that outlines which party is responsible in the event of a loss. Most indemnity provisions are broad, so they include language such as ABC company shall indemnify, defend, hold harmless, city XYZ for all claims, liabilities, and that's how they're written. They're intended to be broad and not narrow. We don't recommend that you update it to specifically reference COVID-19 because, knock on wood, that this doesn't happen, but what if there's another strain of the virus next year or in the years that follow. So it's best to keep your indemnity language broad in your contracts. But again, to address the heightened concern with the possible allegations that a contractor or consultant got COVID-19 at your agency, what you can do is provide a copy of any local public health orders, any industry-specific guidance for that particular vendor or contractor, have them sign an acknowledgement saying they've received the information and that they're responsible for following local health orders. That would also help any concerns you may have. And then lastly, a question we received was, should we update our participant waiver to reference COVID-19? Participant waivers are also written, like indemnity provisions, to be broad and not specifically mention different exposures. So what we did with our participant waiver template that is available to our member agencies is we added communicable diseases, viruses, and illnesses as understood and assumed risks to potentially cover any future strains of the virus or any other viruses that we may face in the future. That's all I have, Marcel. I'll turn it over to Arnold.
Thanks, Maria and Jeff. I'm going to switch the slides 1 second. Arnold, if you want to just do a quick introduction of yourself while I'm switching them over, it's all yours.
Sounds good. Thank you, Marcel. Actually, I'm the late person to the panel. I received a phone call from Marcel a couple of days ago, and as we all know, if you get a call from Marcel, you take that call. And so I'm happy to be here this afternoon. While Marcel may be in a bunker somewhere, an unknown location, I'm making my presentation from our Northern California office in Napa Valley, so I'm happy to be up here and trying to stay safe. Good afternoon to all, and I hope you're all staying well and safe. My presentation isn't going to be very technical. I'm going to give some of the observations I've experienced in representing a number of cities in Southern California, and some of the questions I get from staff and approaches that I think are something that all of you should consider as you evaluate what is going on in your respective agencies due to COVID-19. I checked to see who's on the participant schedule. I think I only have one of my mayors on the panel, so I believe Mayor Perez is on the listening in. So I also want to make sure that as it was understood in the first series of panels, that my comments today are not legal advice, and you should be consulting with and contacting your own city attorney or legal advisor. My next panel, please. I think Marcel covered who I am. I'm the founding partner of Alvarez Glassman & Colvin. We specialize in public agency work primarily with cities. Next panel. So there's some issues to consider as we go along today. This is a set of new circumstances that we've never faced before in all of our lifetimes. And I've always said that just when you think you've seen it all, you see something new, or you see one more thing. Change is going to be the only thing that's constant in this process. And as I go through these panels, there are three primary strategies that I'm presenting on facing the challenges of addressing COVID-19, and that is be proactive, be reactive, and be protective. And of course, stay current and flexible. And most importantly, from my perspective in dealing with my cities, is to keep your community and elected officials informed and involved. Next panel. As we all know, COVID-19 and the impacts have impacted all of us at the local level in a manner that we never had expected 6 months before. If we turn back the clock and go to February as this was starting to unfold, the method of operations for all of our cities were fairly normal, fairly consistent, but then COVID-19 hit, and it became important for all of us to evaluate how we are handling the business of running local government and looking to see how we can have our organizations do things differently and do them better under the circumstances of the pandemic. Next slide. You know, when I say just when you think you've seen it all, you see something new, it's important for all of us to go back and look and take an introspective approach to how cities have been operating. It's important to remember to adjust to those changes and to be creative in the manner in which we're trying to address providing our services. You know, it was mentioned about taking temperatures of individuals who come to do business at city halls. Again, you should consult with your own legal counsel. I take the approach of giving advice to my clients that is appropriate, and not so much to see what is going on with the person that's coming to do business, but to provide a layer of protection for our employees. So again, that's not intended as legal advice for your agencies, but we are implementing a number of measures that try to provide the most safety for our employees so that we don't have risk management and workers' compensation issues. It's important to take a close look at your policies and procedures currently in place. I would venture to guess that as we started this pandemic, most cities didn't have this level of procedures in place to address the crisis that we're facing. So go back, work with your risk management team, work with your attorneys, work with your carriers to make sure that you have the proper practices in place. One of the key elements that is important is to learn from others, interact with your colleagues. Precisely what we're doing here today is sharing our viewpoints on this pandemic and how we address it. Nobody knows everything, and it's important to make sure that we work together collaboratively. Next slide. My other comment is the only thing that is constant is change. Again, look forward. You know, we sit here now in September, heading towards the end of the year. If we stop and reflect upon the first 6 months of the pandemic, who would know that we'd be facing the types of things that we're facing today and trying to address issues like how do we provide parks and recreation services. The other night at one of my city's council meetings, their Parks and Recreation Department had put into place a whole series of virtual programming. So they took the style of program that they would take with youth and seniors, and now are doing like we're doing here today, making it virtual. So you know, try to be creative, try to be adaptive. You have to look forward, not just for today, but a week from now, a month from now, and even a year from now. Look at your insurance policies and employees' policies and practices to make sure that they are covering what is needed for the risk elements that we face today. Again, make change, be ready for change. And sometimes in organizations such as cities, we're slow to change. We are not one that wants this type of massive change, but we have to adapt to our new paradigm. Next panel. As I mentioned, the 3 strategies of be proactive, be reactive, and be protective. Take the time to review your employee MOUs, your safety practices, contracts, agreements, and also, especially in the area of the force majeure language, which is the language that will exempt or allow forgiveness of adherence to the terms of the contract based upon acts of God and pandemics. It's important to look at all of those as you come forward with new contracts, because that's an emerging area of the law that we are actually, as lawyers, are taking a close look at what's going on and what's covered or not covered under the area of force majeure. When I mentioned about being reactive, when you face the new circumstances, again, it's important to identify the new procedures and how you address those with your employees, and make sure that you do it in such a manner to reduce grievances, to reduce risk. Develop a process that provides quick answers to these issues, because the worst thing that's happened through this process is the lack of certainty, and more certainty we have, the more certainty our departments and employees have, the better they feel about the circumstances. And lastly, be protective. Develop those safeguards, and not only for the employees, but also for the public. As we mentioned about, it was mentioned about recreation programs and the use of parks. Many, like actually most all of the parks for my cities are still remaining closed, or at least implementing socially distanced measures and postings so people know what can and cannot be done. Youth sports programs are out the door right now. They're being put on hold because the safety measures that are needed to protect the youth. My advice to my clients is avoid having children or seniors or anyone being placed in that circumstance, and it's better not to have those programs happen face-to-face in person. Next slide. As I mentioned, stay current and flexible. Organizations view risk generally on the severity or the cost of that risk and the frequency or the likelihood or reoccurrence of that risk. But it's important to be ready for significant risk changes. Acknowledge the need for change in operational elements. That will reduce risks and reduce the exposure to claims and lawsuits. It was mentioned how we've changed the way we do business. Also the closure of courts, that has significantly impacted the legal field, and also all of us in the city attorney world that does litigation. It's difficult to get matters moving forward on behalf of our clients. So again, look ahead, make sure you stay current. Slide. It's vital to keep your community informed, your employees informed, and most importantly, our elected officials informed. Inward information and outward information is invaluable to reducing risk. Keeping people knowledgeable of what they should and shouldn't be doing, keeping our employees knowledgeable of what are the new norms, new practices, helps reduce risk. Letting your community know that you have a plan instills confidence in the manner in which we operate local government, and also hopefully will reduce claims and the likelihood of claims. Again, letting employees be part of the process of being able to identify how the new practices are going to be put into place. Those of us in the city attorney practice, we know city attorney work. We don't necessarily know what it takes to pave a street or to repair a piece of equipment. So it's important to engage your employees so that they have a say in what's going on. And lastly, and probably most importantly, is keep the elected officials, your council members, informed and involved, and they also have great ideas to be examined on implementing practices under COVID-19. I think that's my final thought is don't expect to get it right 100% of the time, but it's better if you do. Like other areas of risk management, review carefully your policies and procedures to limit risk exposure. Take time to clean up the potential risk weak spots, and most importantly, be safe and stay positive. Thank you.
Thanks, Arnold. We appreciate you. So what we're going to do now is I'm going to open it up for question and answers. So those of you that are participating, if you look at the top right of your, if you're on your phone or if you're on your iPad, there's a Q&A button there. That's where you're going to go to type in your questions. You can enter them into the chat and share them with us as well. So we'll give you all a couple minutes to type in your questions. I'm reading some of the comments in the chat here. So if you have any questions, please enter them now. And somebody was calling me right in the middle of this, of course. Please enter your questions. If you have any, we'll give you a couple, about 30 seconds or so, 45 seconds. First, I want to thank Jeff and Maria for participating today, and Arnold especially for jumping in at the last minute. I know it was kind of a short notice, but I think you did a great job. And I really, really appreciate the information, particularly on 1159, Jeff. I know that was a last minute ad. Obviously, it's real time stuff that's going on right now. So we appreciate the information on that and the impact that it might have on our public agencies, our cities, as they gear up for some partial kind of reopenings or whatever they might be doing to protect, residents and still continue to conduct business. There's still some things that you just can't shut down. You can't shut the entire city down until we're to a point where we're past COVID-19. But I don't see any questions right now. So I'll just say once again, thank you. I think probably you were so thorough that you answered all of the questions. So again, thank you for that. Thank you for everyone participating. We really appreciate you. And for those of you out there watching, join us next week for our final installation of our virtual fall educational summit, which is going to be a November 3rd ballot update. I'm sure that's going to be packed with tons of great information. So if there's no questions coming in, wait, I got a question. Wait. Oh, this is just Hyde from Edison saying thank you to the presenters for the information. It was just really incredible, informative session. So thank you all. We'll see you all next week. Have a great day.